We welcome our viewers around the world. In this documentary, Africa's healthcare has fallen. The medical doctor shortage killing millions. We explore the alarming reality of Africa's healthcare crisis. With one of the lowest medical doctor-to-people ratios in the world, millions of people across the continent are facing life-threatening delays in medical care, leading to increased disability, widening health disparities, and death. We dive deep into the devastating impact of this shortage on the population and how the exodus of doctors is crippling medical services and research, and what urgent steps must be taken to prevent further catastrophe.
The learning objectives are on your screen. In this documentary, we examine Africa's healthcare and innovation gap, which leaves millions without proper care. Despite WHO and SDG 3C's efforts, progress remains slow. We compare medical doctor-to-people ratio in Nigeria, Ghana, South Africa, and the US, highlighting WHO data that shows Nigeria has just one specialist for 500,000 people. We assess the impact on specialty care, maternal and infant health, and malaria survival rates. Finally, we revisit the Abuja Declaration, identify countries that met the 15% health funding target, and explore key strategies to address Africa's doctor shortage. We recommend viewing our video documentary titled How Research and Development Spending Shapes the Future of Innovation. We review the low budget allocated to research and development in Africa as a key reason Africa lags behind in technology. This question, why does Africa remain underdeveloped? Despite its abundant resources, lingers in the minds of many. Africa is blessed with vast natural and human resources, yet it remains burdened by poverty, underdevelopment, and stagnation. The answer is straightforward. Africa lacks visionary leadership. Leaders think strategically, planning 20, 50, or even 100 years ahead, always looking for opportunities to advance their civilization, their society, their country. Unfortunately, what Africa has instead are managers, individuals who merely oversee their countries, much like the colonial administrators before them. They are overseeing the managed decline of their civilization, their societies, their countries. In many African nations, little has changed since independence. Hospitals and healthcare infrastructure built over 5 decades ago by colonialists are still regarded as state-of-the-art, while those constructed by post-independence governments are often poorly designed and deteriorate within years. For example, there were reports in the media that Nigeria's premier and top-tier hospital, University College Hospital Ibadan, established in 1952, pre-independence, was without power for more than 3 continuous months through February 2025, and with no backup generators to provide adequate power at all times for the whole hospital. Regarding public infrastructure, most of the roads remain largely the same, repaved but riddled with potholes. Public health has also fallen. Public water taps are dry and have been so for decades. Governance is reactive rather than transformative, with leaders failing to innovate or invest in long-term development. Their mindset is stagnant, trapped in outdated modes of thinking, leaving their nations lagging behind in technology, healthcare, engineering, and industrial growth. These heads of states are only famous for begging for international aid, and in so doing, bring only shame, embarrassment, and dishonor to the hard-working, proud, courageous, peace-loving, and long-suffering good citizens of their countries. As a result of the inability of these heads of states to think strategically, their people suffer, not just from economic hardship, but from the failure of leadership itself. African citizens remain hostages to a cycle of mismanagement and lost potential, victims of those who hold power yet refuse to lead. The future of the continent depends on breaking free from this cycle and embracing true visionary leadership. For the sake of our ancestors, for the sake of humanity and future generations, including the unborn, we are optimistic that sooner rather than later, visionary leaders will emerge on the continent. According to the World Health Organization, the Sustainable Development Goal Agenda recognizes universal health coverage, UHC, as essential to achieving all health targets. SDG 3C aims to substantially increase health financing and the recruitment, development, training and retention of the health workforce in developing countries, especially in least developed and small island states. In response, WHO and partners developed the Global Strategy on Human Resources for Health, Workforce 2030 GSHRH, to advance UHC and the SDGs by ensuring equitable access to health workers within robust health systems. Resolution WHA 69.19 urges member states to consolidate core HRH data with annual reporting to the Global Health Observatory and progressively implement national health workforce accounts to support policy, planning, and GSHRH monitoring. On your screen is a color-coded global map of medical doctor-to-people ratio expressed as medical doctors per 1,000 people in year 2000. The lighter-colored areas representing areas with low medical doctors per 1,000 people are mainly in Africa. The updated map in 2021, the year with the most current data at the time of this documentary, shows progress in improving the number of medical doctors per 1,000 people in many parts of the world, including Africa. If we focus on Africa in 2021, Algeria in North Africa had the highest medical doctor-to-people ratio at 1.73 medical doctors per 1,000 people. Cuba was the country with the highest medical doctor-to-people ratio in the world, with 5.94 medical doctors per 1,000 people. By 2021, in addition to Cuba, there were now more countries with high medical doctor-to-people ratio, signifying progress in the training and availability of medical doctors. In South America in 2021, Uruguay had the highest medical doctor-to-people ratio with 6.2 medical doctors per 1,000 people. In Asia, the Republic of Georgia had the highest medical doctor-to-people ratio, with 5.41 medical doctors per 1,000 people. Europe had the most countries with the highest medical doctor-to-people ratio. Let us now focus our attention on South Africa, Nigeria, and Ghana to evaluate progress made increasing the medical doctor-to-people ratio over the last 6 decades beginning in 1960. As depicted on the graphic on your screen in South Africa, the medical doctor-to-people ratio increased from 0.49 in 1965 to 0.81 in 2021, representing in simple terms an almost twofold increase, or 65% relative percent change over 6 decades. Regarding Nigeria, the most populous black country in the world, in 1960, the medical doctor-to-people ratio was 0.02 per 1,000 people. The most recent data in 2021 reported an increase to 0.4 per 1,000 people, thus signifying in simple terms a 20-fold relative increase, or a 1,900% relative change over 6 decades. The medical doctor-to-people ratio in Ghana was 0.05 in 1960 and 0.16 in 2020, signifying in simple terms a 3.2-fold relative increase or 220% relative change over 6 decades. According to the WHO Global Health Workforce Statistics database, in Nigeria as of 2023, there were 86,642 medical doctors out of a total projected population of approximately 228 million people. This means that of the total population, approximately 0.04% were medical doctors. Of these medical doctors, 462 were specialist medical practitioners, representing 0.5% of all doctors in the country. The remaining number, 86,180, 99.5%, were generalist medical practitioners. This is an extremely low number of specialist medical practitioners and may indicate underreporting of the data. However, based on this data, there was 0.000002 medical specialist for each Nigerian. In other words, and, in simple terms, one specialist medical doctor for 500,000 Nigerians. Clearly, Nigeria urgently needs more medical specialists. The number of medical specialists hasn't always been this low in Nigeria. In 2018, there were a total of 74,543 physicians and 3,035 medical specialists. 4% of physicians were specialists. So what happened between 2018 and 2023? The harsh economic conditions in the country, poor physician pay, approximately $4,800 per year median salary for senior doctors in Nigeria versus approximately $250,000 per year median salary of medical doctors in the US. And poorly equipped hospitals forced many specialist doctors to seek employment in the West and Middle East, causing a brain drain of medical specialists. This brain drain of medical specialists came to be known as japa, a Yoruba verb meaning to swiftly depart, abandon, or sever ties with an inhospitable location or situation, in pursuit of a more favorable environment or opportunity at the earliest possible moment. This is ominous for the future of the country when the young and brightest citizens are abandoning the country for better opportunities in other countries eager to have them. Utilizing the WHO Global Health Workforce Statistics database, we compared data between the United States and Nigeria. As of 2019, the most recent year with a complete dataset on specialist medical practitioners, the US had approximately 1.2 million physicians. Of these, about 1 million, 88%, were medical specialists. The population was approximately 328 million people. In simple terms, this represents approximately 3 medical specialists for 1,000 Americans. We have complete dataset for South Africa in 2018. There were 43,503 medical doctors, of whom 14,192, approximately 33%, were specialist medical practitioners. The medical doctor-to-people ratio in that year was 0.74 doctors per 1,000 people. The total population of the country was projected at approximately 58 million people. We have data from the United States. From 1960 to 2020, the medical doctor-to-people ratio increased from 1.10 to 3.56. This represents, in simple terms, a relative threefold increase, or a 224% relative increase over 6 decades. Nigeria has made very limited progress increasing the medical doctor-to-people ratio, even as its population continues to increase. This is reflected in the increase in infant mortality rate, under 5 mortality rate, maternal mortality ratio, and the very high mortality from malaria infection and other communicable diseases such as polio. We have covered these topics in prior documentaries on this channel. Our viewers are encouraged to view these video documentaries. In Nigeria, a catastrophic consequence of the very low number of medical specialists is that late-stage presentation of breast cancer is common due to poor health-seeking behavior and limited access to treatment. Under the leadership of President Olusegun Obasanjo, African heads of state met in Abuja, Nigeria, April 2001 to discuss the health crises from HIV/AIDS, tuberculosis, and other communicable diseases. They pledged to set a target of allocating at least 15% of their annual budget to the improvement of the health sector. On your screen are the allocation of health expenditure as a percentage of GDP. The US allocated 16.57% in 2022, Rwanda 4.32%, Nigeria 4.08%. In 2025, Nigeria allocated 2.48 trillion naira to healthcare, representing 5.18% of its approximately 48 trillion naira national budget. This is a slight decrease from the 5.46% allocated in 2024. The failure of most African countries, including Nigeria, to meet the 15% Abuja Declaration target highlights a critical healthcare funding gap. With only 4.06% of its budget allocated to health in 2021, Nigeria lags far behind, jeopardizing access to quality care. Meanwhile, Cabo Verde and South Africa met the target, showing that commitment is possible. Urgent reforms are needed to prioritize healthcare financing and strengthen systems to improve health outcomes across Africa. Here are recommendations to improve the low doctor-to-people ratio in Africa. Number 1. Increase investment in medical education and training by expanding medical schools and training institutions to produce more medical doctors, providing scholarships, subsidies, and incentives to encourage students to pursue medicine, improving medical curriculum and infrastructure to meet global standards. Number 2. Improve the retention of healthcare workers by offering competitive salaries and better working conditions to reduce brain drain, JAPA phenomenon. Providing career development opportunities, continuous training, and specialization programs. Implementing policies that incentivize doctors to work in rural and underserved areas. Number 3. Strengthening health workforce policies and planning by developing long-term health workforce strategies that align with population growth. Using data-driven planning to ensure equitable distribution of doctors. Supporting task shifting by training mid-level healthcare workers to handle basic medical needs. Number 4. Leveraging technology and international partnerships by expanding telemedicine to bridge the doctor shortage in remote areas. Partnering with international organizations to fund healthcare workforce development. Encouraging diaspora doctors to contribute through short-term programs, training, and knowledge transfer. In summary, the healthcare system in many African countries is in crisis and many have fallen. The very low medical doctor-to-people ratio generally leads to delayed, less comprehensive, and inadequate care across the healthcare spectrum. This gap has resulted in many adverse health outcomes, including deaths that would have been preventable. Addressing these challenges requires urgent systemic interventions, such as increasing the healthcare workforce, enhancing training, and improving resource allocation to ensure timely and effective medical care for vulnerable populations. The learning objectives of this video documentary have been met.
If you enjoyed this video, don't forget to like, share, and subscribe. This has been a presentation of Apomulero Media LLC. By subscribing, you ensure you don't miss out on our future videos that delve into fascinating topics from around the world.